Treating Gen Defects by Juan Felipe Vargas, Federico Aragon, and Santiago Pimiento. Introduction.
Actually, in the world of medicine, a lot of known diseases are caused by a mutation in a gene or genes of a person. For that reason, the study of genotypes of people have been a very important and clever tool to prevent, find, confirm, and treat situations as diseases or mutation. Even nowadays, when a children born, they do tests that can detect health abnormalities and genetic disorders, but they could not detect some type of genetic problems. For this, it exists a more rigorous and detailed genetic test that is a sequencing a person genotype that will permit understood the person DNA chain and could be useful to detect mysterious inheritance conditions or diseases. But even using the technique of sequencing the genotype, it could be difficult to find something as a mutation, as this could happen anywhere and it's very difficult to find it in the long areas of DNA. As well, the information given from our genotype doesn't confirm nothing. As for example, if my genotype established that I could have cardiac problems, that doesn't mean it's something that is completely sure, because it also depends of the lifestyle we choose to follow. As well, this could happen oppositely. As if my genotype doesn't establish that I have cardiac risk, but I don't care what I eat and I have a lot of excesses, I could develop a cardiac problem.
Ethical implications.
Genetic testing at birth. This idea proposed that when each baby born, they get this genome sequence to try to detect disorders, disease, and future health problems. This sounds very good at once, but have a very bad situations. As for example, what it will bring the results of that genotype sequence that will bring a stigmatization problem in their kid's life. As if we know what are the areas in which my kid could have a health risk, a lot of parents will take the extreme precaution with its kids, for example, not letting them to sport activities only because their genome show a cardiac risk that is not manifest yet and is not confirmed. Discrimination. As well, making your genotype public can make that the discrimination could increase, as people that have a less problematic genotype could feel they are better or can treat differently to people who have a more problematic and risky genotype.
Privacy. It is a reality that when you carry out your genome sequence in any type of biotechnology company or any other health center, you take a risk because your privacy position itself in a vulnerable situations, since the information is stored in the internet cloud, and from there it can be hacked and therefore reach at the hands of anyone, or it can even be manipulated by the same place who carried the sequence. This for investigation purposes. Information from a person's DNA could pose a risk, since it says a lot about who we are, the lifestyle we lead, our models, and our biological strengths and weaknesses, which could lead to extortion and unauthorized analysis or a type of experiment with the information of our genotype if the information is stolen. That is why companies are making the decision to store the results of our genotype in numerical codes, which will be not allow the information to get into the wrong hands, and only the owner of the DNA and the doctor in charge know the results and thus protect the user privacy. However, there is also the risk that many companies that become aware of this type of procedures might share the private information for money with ensure or other commercial interests with the intention of exploring the information for their benefits or loss. Therefore, it is not as visible to do the sequence to human genome to newborn children, and it is truly a high risk from which there is no assured way to protect the privacy.
Should we hear parents or doctors? As a good and caring father, I would like to know if my own children were likely to have a condition or a disease. I would like to know if they have a disease from an early age, from the moment he's born until he's 1 or 2 years old. It is important to know about the disease from a reasonable time in an early time, so me as a father can act rapidly so my child can get rid of the disease as fast as he can, if possible. I would get him tested, obviously, without his consent, because I would test him when he is in an early age between 1 and 2 years old, so he can say too much about it. To make sure and guarantee his well-being, I would take my child to the best professionals there are at the time or available in order to avoid complications at the moment of testing, such as an injured nerves, excessive bleeding, or something more.
Downside surrounding the genetic testing of children.
Inclusiveness and uncertainty. One downside surrounding the genetic testing of children is that the results can be returned inclusive and uncertain, and the testing or results does not eliminate a person's risk for a determined disease. If you get yourself a test, in case it comes out positive, it does not ensure that you in fact have the disease. If your test comes out to be negative, it can deny the fact that you have the disease, so you might have it, but because it evaluates only the more common mutations, so the test is not exact. A false positive or a false negative in a child can be very dangerous, since in case it is a false positive, the parents will want to give the kid the appropriate treatment, and he may experience unnecessary symptoms from the treatment that is being given, and that can affect his health. In case it is a false negative, the child might be having the disease, but since his results were negative, the child's parents will not do anything about it, and they would be abandoning his healthcare. Consent. Another downside surrounding the genetic testing of children is the fact that parents do not have the children's consent to be tested. However, parents do it anyway to be sure of the child's health. Screening requires just a few drops of blood from the child or person who is going to be tested. In case that the doctor or nurse takes the patient's blood out of him incorrectly, it may cause an injured nerve on the patient. The kid can faint due to the excessive bleeding, or it can cause an hematoma due to the amount of blood under the skin.
Conclusion. We all agree that the treating of gene defects by using the technique of sequence of the genotype is a tool that must be only used for people that suffer a strange or no condition that is seem have a genetic explication, as this is the case of the kids in the video, Alexis and Noah. We think this is the most correct decision, as it will help people really need the help and will avoid previous worries, fears, and stigmatizations of parents. You do what it shows the genotype of his son. As well, only use this strategy for limited people. We also reduce other ethical consideration as discrimination, privacy, and debating between doctors and parents. To conclude, we think that when kids born normally and looking without problems, it is enough to do the routine and common blood test to above check of the person's health. These are the APA references, and thank you for listening.